On today's show, we're going to be talking to Dr. Justin Schweitzer from Sioux Falls, South Dakota, with Vance Thompson Vision on really advanced co-management. All right, Dr. Justin, thank you for joining us in this episode. You know, I have to share with you, pre-COVID, you were one of the last lectures that I saw. I think it was at Vision Expo West. You and another doctor from your practice, Dr. Birdall, gave arguably what I thought was one of the best glaucoma discussions I've seen in a long time. And it was cool because it was you up there and it was Birdall up there, an optometrist and an ophthalmologist who it was very obvious that you guys worked a lot together and worked well together. And it was interesting the way that you guys presented the information. And you really saw from that discussion that ophthalmology is becoming increasingly specialized in terms of the surgical techniques they're performing and they're doing, and all of the changes that are happening so fast, not in only glaucoma, but in any area of optometry. And then we saw you, who was co-managing with that ophthalmologist. But in addition to that, I mean, really had a mastery of the pharmaceuticals around glaucoma management. So Justin, share with the audience a little bit more about your practice and really what your level of involvement is in the practice.
Yeah, you bet. Well, first of all, thanks so much for having me, and thank you for the kind words. That means a ton to me, especially coming from you, who obviously is well versed in all areas of medical optometry. So I really appreciate those words. So thank you, Mile. In regards to the practice, you know, we are a tertiary care center. We're a 3 ophthalmology practice with 6 optometrists, and we have OD resident as well as a MD fellow that's with us on a yearly basis, and then we also take some students as well, so externships. And our real belief is that we're an extension of our referring optometry's network. Like, our referral optometrists, if they need us for something involving anterior segment disease or glaucoma, we want to be available for them. That may mean surgery. That may mean just, hey, another second opinion. And then once we have answered that question, or once we've done a surgery, our goal is to get those patients back to our referring optometrists. And that's worked really well for us. For us as optometrists within Vance Thompson Vision, I love it because I get to practice at the highest level possible for optometry. And the ophthalmologists that I work with really allow us as the optometrists in the practice to run the clinic. They want to spend their time in surgery, and so they don't even have a clinic schedule. The majority of their time is in surgery. And what we're doing as the optometrists in the practice is we're getting patients either prepared for surgery, or we're doing some of those glaucoma evaluations, or we're handling some tough anterior segment disease. And it brings a lot of joy to me to be able to do that. So they place a lot of trust in us, and it works well because it allows our patients to get into surgery in a timely fashion. Mm-hmm. They don't have to wait months upon months to get in for surgery. They can get in typically within 2 weeks because our schedules aren't bogged down and our surgeons aren't bogged down with having to see a tough schedule. That's what the optometrists do, and it's worked really, really well for us.
That's great. It's interesting, Justin. So hearing you speak and hearing the way you kind of communicate about really what's happening in your office, you kind of take a step back, and now you look from my perspective. So I'm in private practice, and we rely on those facilities like yourself who are providing that tertiary care. Whenever you're talking about any type of surgical needs, we have those specialists in place to be able to deliver that care. But I think it's really created a new set of responsibilities for that forward-thinking, full-scope, medically oriented optometrist, because we really now are managing things at another level, and we really are partnering with the ophthalmologists. It's not we kind of send them, they do cataract surgery, and then when everything's all said and done, we see them back. I mean, we usually see these patients back the next day, and we're really managing these individuals post-operatively. So we're not only left with the good outcomes, but we're also managing the post-operative outcomes that may not necessarily end up the way we want them to be. So Justin, I mean, share with me what you feel optometry's role is now going to be in the future with co-management, knowing where it is right now. I mean, how important is it that optometry really embraces this and continues to partner with ophthalmology so that patients ultimately get the best care possible?
Yeah, it's huge. And you just said it with your last statement. They're the best care possible for our patients. And why is that? Well, think about it. Cataracts aren't going away. Okay, let's just take cataract surgery, for example. More and more patients are going to end up with cataracts. Well, if the surgeons are bogged down with doing a bunch of post-operative care on these, how can they do surgery on all these patients? So it's not necessarily optometry, ophthalmology, it's hurting the patient. And so the most important thing is if optometry can embrace those one-day post-ops in 1 week and 1 month and deal with some of the complications that can occur, we're going to make our patients' lives better because it's going to free up surgeons to do more surgery, which needs to be done. And that can be with glaucoma, that can be with cataract, it can be with advanced anterior segment surgeries as well. So to me, that's really the key, is it's better for our patients in the long run. And with all these diseases, whether it's glaucoma, whether it's keratoconus, anterior segment disease, the prevalence is only increasing. You see the numbers. More and more of these patients need care. And so we have to be willing to manage them. And then the final piece is, as the primary care optometrist in a private practice, you know your patients way better than what I would know them if you sent them to me or to the surgeon I work with. Like, I don't understand their visual needs that well. I'm getting to meet them for an hour, maybe an hour and a half. And I'm trying to understand, well, what do you want to do with your eyesight after this particular procedure? Where you've been managing them or know them for years upon years upon years. And so it's so important. And I take it very seriously when an optometrist calls me and says, hey, Justin, I think this patient would do really well with the trifocal IOL technology. Great. Or they say, I don't think he would do well with it. I would stick more along a monofocal implant. And I'm going to fit him in glasses or contact lenses afterward. I take that so seriously because they know the visual demands of that patient. And it's so important that we continue to embrace those things.
Yeah, I love the way you communicate. It's almost kind of like, when you get to that tertiary care level, it's almost like you're an extension of the care that the optometrist that referred them is providing. So it creates this not disjointed system of care, but a continuum of care. And I love that too, Justin. We have great relationships, very similar to the ones that you described with our local surgeons here as well too. So Justin, we have just a few more minutes here. I'd like to kind of just pick your brain a little bit. What's maybe one or two things in the anterior segment surgical space or even glaucoma surgical space that we can kind of expect to see maybe, either just kind of coming into the profession now or maybe in the next few years that we'll be seeing? Is there anything new that we should be looking out for?
Yeah, I think there's, for me, I'm kind of a glaucoma nerd. I love the glaucoma piece of things. And so really glaucoma drug delivery is a big thing that's coming. And we already have one, right? There's already one on the market, a Biomechanical SR. It's available. It's something that, is being utilized, but there's more of these coming. There are going to be devices that can be implanted inside the eye. There's work being done with, plugs. There's work being done with rings, contact lenses possibly. And so I think that's a big piece, trying to decrease compliance issues, trying to maybe reduce some medication burden on our patients. And optometry will play a role in that. We'll be a part of that. Maybe not with implanting something, but possibly. And we'll be a part of the other things too. And then the other thing for me is, looking down the road at, more IOL technology. We now have a light adjustable lens. We have trifocal implants. So I think not necessarily saying, hey, patients aren't going to wear glasses or contacts anymore, but no, reducing dependence on those things for patients that want that. And to me, that's exciting because if you give patients choices and it makes their quality of life better, that's really why we're in this business. We're in the business to help people and we're in the business to make them see better and make their quality of life better. So I think for me, it's IOL technology and, glaucoma drug delivery are what I'm really excited about.
Well, Justin, I appreciate you so much for being available for this and taking time out of your day to share with us not only your perspectives on co-management, but really what's kind of new and coming in the anterior segment and glaucoma space. And thank you, audience, for joining us. Make sure you subscribe. Make sure you listen to future podcasts and previous podcasts as well, too, where we're talking to leaders in the profession on really what's happening contemporary and what's new in the profession. Thanks, Justin, for being here. And audience, thank you for joining us today.